One of the issues that the president brought up was on the transgender issue. Look at this clip.
Now I want Congress to pass a bill permanently banning and criminalizing sex changes on children and forever ending the lie that any child is trapped in the wrong body. This is a big lie. And our message to every child in America is that you are perfect exactly the way God made you.
A powerful moment. As President Trump noted, we are seeing a return to common sense. Just last month, I might add, Oxford had an academic journal of sexual medicine. They released a new study showing what we already knew, and that is Americans who struggle with gender identity are significantly at higher risk for depression, anxiety, suicidal ideation, substance use disorders, and on and on. And that particularly if they undergo transition surgeries. So will we be seeing more reports like this now that we're seeing more pushback against the trans ideology? Well, here to close out today's special edition of Washington Watch is Dr. Jennifer Bauwens. She's the director of the Center for Family Studies at the Family Research Council. Dr. Bauwens has worked extensively as a clinician providing trauma-focused treatment to children in foster care and behavioral health settings, as well as adults who've experienced interpersonal traumas such as sexual abuse and assault. Dr. Bauwens, welcome back to Washington Watch. Always great to see you.
Good to see you too, Jody. Thanks for having me.
All right, first, your thoughts when you heard what the president said last night regarding so-called gender transition procedures and their consequences.
So refreshing. I mean, think about it. Just a few weeks ago, we were listening to someone talk about, gender affirming care as life-saving care. And, we have to follow the science, but they're not following any of the science because it's all, as the president so eloquently and poignantly said, it's all a lie. And I was so enjoying that moment of hearing someone in our highest office confirm that you can't change your biological sex. You can only appear as a different sex.
Absolutely. And I mentioned coming into this, the Oxford study. I know you have been all over this. Can you unpack that a little bit more for us?
Yeah. Well, just on its face, you sort of highlighted the findings already, which basically this was a study that it was pretty large sample size, looking at a data set of about 108,000 men and women who had a diagnosis. Some had a diagnosis of gender dysphoria, some did not. But the main comparison was how did people fare after having the so-called transgender procedures versus those who didn't have those surgical procedures? And the findings, as you mentioned, they're not a surprise to us. That the unfortunate thing is that these people fared much worse after having these surgical procedures than if they did not have them. So what that means in terms of mental health outcomes, those who had the surgical procedures had higher rates of depression, higher rates of anxiety, suicidal ideation, and substance abuse disorders. And in particular, those who were men going for feminizing surgeries, those men actually had really high rates of substance abuse issues, as well as higher rates of depression. And so they were more at risk. So this is, again, this is not a surprise to us. And it's unfortunate that so many people are still going down this path, that we certainly have enough evidence at this point that says, this is not going to be beneficial to your mental well-being.
And I'm sure this is consistent with the studies and experiences you've had personally. Are there other studies out there to correlate with this particular Oxford study?
Yeah, I mean, we're at this point, Jody, we're getting such a large body of research that's screaming, this is not a good path to go down. We have a number of countries that have conducted their own systematic reviews, basically their version of our Health and Human Services. They've conducted reviews of the literature that have indicated the evidence that supports this idea that gender affirming care, and doing these invasive procedures is going to lead to good health, mental health outcomes. And it's just not true. We also have more recent research that has shown that, one of the arguments is that people are having mental distress because they don't have access to this care. Well, we have studies that are showing that actually they're associated with increased rates of suicidal ideation, even when they have access to care. So it just, from the scientific literature standpoint, there is increased evidence that's showing, again, that these are not beneficial, which actually harkens back to 1979. Paul McHugh, who was the head of psychiatry at Johns Hopkins Hospital, he was foreclosing the gender clinic because he basically said what this Oxford study is showing all these years later, which is, the people that go through these procedures aren't really getting any better. They're still dealing with the same pre-existing psychological issues that they had before they went through the procedures. So if only we had listened to the wisdom that came from 1979, we wouldn't be where we are today.
Great point. Well, this is an amazing study, and seeing the president take lead on the truth to this whole issue last night was a powerful and emotional and deeply welcomed statement that he made, as you referenced. But and you may not be able to answer this, but do you think that perhaps we're coming to the point that anyone on the left may finally come to the point of acknowledging the dangers that are involved with these procedures and what they pose to these children, vulnerable children?
And I do think that we are winning some hearts and minds on this issue, especially as you look at across the country and the number of liberal parents, who are ideologically liberal, but on this issue, they're seeing that this doesn't hold up with science. It's contrary to common sense. And but even with this particular study that we're talking about, the disappointing thing for me is that here are these researchers and they're seeing the outcomes of these particular patients who've gone through these transgender procedures, and yet they still say in their discussion section of this paper, of this write-up of the research, they still say, we know that this care is very important for mental health outcomes for those who've gone through these procedures, and they cite some study. And then they proceed to talk about that we need more care, post-operative care. So when I read that, I think, what a strange interpretation. If I were writing that research article, I would have framed it a completely different way. I would have talked about all of these systematic reviews that have been done across the world. And I would have talked about the research that's showing these negative outcomes and how this current research fits with, the previous findings. That's the normal way you would do a write-up. So I was a little disappointed to see that, and it does make me think that we have a lot more work to do, especially in the psychological profession, to win hearts and minds. And that, I think, gets to your point at the beginning of your segment, Jody, that this is not just a legislative issue. This is a fight that we're in for the hearts and minds of this country, and particularly for those who are supposed to be in the helping profession and helping people in their most vulnerable hour.
Well, as you mentioned, though, there does seem to be ground that is being gained. And President Trump last night talked about a common sense revolution I believe was the way he described it. Does it seem to you like some degree, at least, of common sense is becoming common again?
Yeah, I think it is common amongst people who aren't so tied up in the academic sort of we refer to as the elites. I think people who are just uh, common sense people. You don't have to have a PhD to figure this out. That there's a man and a woman. I think
Right. It's not. It shouldn't be this complicated. What we're doing it, Jennifer. Real quickly, we've only got a couple of minutes. You and your colleague Walt Heyer have a new book that's coming out soon, and I know you've been on with Tony, and we've all talked about this previously. But for our viewers and listeners, tell us a little bit about the book and how you hope it'll be a blessing to those who read it, and how it fits into this discussion.
Yeah, well, it fits in really well because what we're talking about is, both being spiritually and politically active and engaged, but also that when we're talking about a profession, a psychological profession that is clearly still needs some help. It's been taken over by an ideology. Then that means that we as the body of Christ, or we as the fair-minded people in this country, need to be the hands and feet of Jesus and ready to help those who have gone through this transgender ideology and are affected. And so we wrote this book to educate people on what the trans issue is and what are the real reasons why some of these comorbidities that are found in this study. And then how do we walk alongside someone? How do we walk alongside them to help them embrace who God created them to be? And that was the impetus for this book. And
how can people get it?
Well, it's on Amazon. You can also get it on embracethedesign.com. And it will be on bookstores, just about every place you can find a book.
Thank you so much, Dr. Jennifer Bauwens, Director of the Center for Family Studies here at the Family Research Council. You do phenomenal work, and thank you for all you do. Thanks for joining us today on Washington Watch.